Republicans and even some Democrats are out to scare you about Medicare for All.
Ah!
They say it's going to dismantle healthcare as we know it and will cost way too much. Rubbish.
Rubbish, huh? Let's hear you give your best, Mr. Reich. So, does everyone remember Robert Reich, the progressive economist from Inequality Media whom every good Bernie bro knows to cite? Well, he's back to teach us the real deal with Medicare for All. I suppose it's only appropriate to call in the ANCAP YouTuber who gave us How to Argue for Universal Healthcare. Lord Killian?
Who dares summon me? Nah, I'm just messing with you. How's it going, my 2 cents?
You up for debunking Robert Reich?
Well, I've already done 5 of his videos, but why not? No tunes like the old tunes.
Awesome, let's do this.
Here's how much the typical American family now spends on health insurance premiums each year. And here I add in the co-payments and deductibles that doctors, hospitals, and drug companies also charge you, and typical out-of-pocket expenses for pharmaceuticals.
I happen to agree that the average American family is paying way more for their healthcare and insurance than they should have to. But then again, despite what Reich and his left-wing ilk would have you believe, we do not have free market healthcare in the United States.
In fact, England notwithstanding, most European countries have a greater level of private health care than the U.S. Insurance companies in this country are either restricted from or required to cover numerous services. You can't even purchase it across state lines. New hospitals have to get a statement of need before they can open, which basically means permission from their competition. AMA-stacked licensing boards restrict the amount of physicians available to keep salaries high, and when we import doctors from countries like India, they restrict them even further. Doctors spend far more time filling out required paperwork than they do seeing patients. On and on and on. Really, the only industry more regulated than healthcare in America is the banking industry.
Increased regulations means higher costs. As George Mosley writes in his paper, The U.S. Healthcare Non-System, 1908 to 2008, in 1908, healthcare was virtually unregulated and health insurance non-existent. Physicians practiced and treated patients in their homes. The few hospitals that existed provided minimal therapeutic care. Both physicians and hospitals were unregulated. When patients saw a physician, they paid their modest fees out of pocket. They were more concerned about the wages they would lose if illness kept them out of work than about the cost of their medical care. Now, more than 100 years later, Americans are paying astronomically higher costs for healthcare, while overworked doctors spend the majority of their time filling out government-mandated paperwork as opposed to actually treating patients.
And Medicare was a big reason for a lot of that. In fact, medical costs began soaring in 1965 just after Congress created Medicare and Medicaid, and anyone trained in economics should be able to see why. Congress projected that Medicare's costs would rise to $3 billion in 1990, which would have been $12 billion after adjusting for inflation. In actuality, Medicare ended up costing $98 billion in 1990, and it's only gotten worse. But more than that, we're paying for it. The Medicare-Medicaid portion of payroll tax started out at 0.7% divided between employer and employee. Now it's 2.9%, more than 4 times as much. And there are additional taxes added on by the Affordable Care Act up to 3.8%. In the 80s, Congress tried to control the costs of Medicare, and it resulted in Medicare costs rising twice the rate of healthcare costs in general. By 1992, Medicare and Medicaid accounted for 31% of the healthcare market, and yet, by that point, seniors were already paying more money out of pocket for health expenses than they were before Medicare passed, even after adjusting for inflation. So you'll forgive me if I don't believe your projections for Medicare for All, which is really just a fancy new name for single payer. All of the previous projections underestimated the costs by at least an order of magnitude.
But that's not all, because some of the taxes you now pay are for health insurance too, for Medicare and Medicaid and for the Affordable Care Act. So let's add them in again for the typical American household.
Comparing private and public spending is extremely disingenuous, but I'll let him finish before I say anything more.
That's a whopping $8,975 a year. Oh, and this number is expected to rise in the coming years. Not a pretty picture.
I couldn't agree more. So why don't we deregulate the healthcare industry and allow supply and demand to work?
If you're a typical American, you're already paying far more for health insurance than people in any other advanced country. And you're not getting your money's worth.
Suppose I grant that this is true. Does it follow that those other advanced countries actually have better healthcare systems?
Because you know who's paying even less for healthcare? Third world countries that don't have any healthcare. There's a difference between what you spend and what you get.
According to a 2017 study by the US-based Commonwealth Fund, Britain's NHS is allegedly the best healthcare system in the world. However, I'm absolutely baffled as to how they reached this conclusion, since the NHS has one of the lowest cancer patient survival rates in the world, some of the longest wait times for crucial surgeries and treatments, and in many cases, physicians are outright calling for euthanizing dying patients so as to save resources.
And there are a lot of other examples that you can see in my video, How to Argue for Universal Healthcare.
So is overall healthcare cost really the only thing we should be concerned about when it comes to healthcare? How about actually getting the healthcare you need when you need it?
The United States ranks near the bottom for lifespan and infant mortality.
This is also misleading. Non-viable babies who die after delivery are classified as live births in the US, while most other countries classify such births as stillbirths. So it's no surprise that the US ends up recording higher infant mortality rates. Beyond that, comparing mortality rates between countries is a poor indicator for healthcare quality anyways, given that there are many different causes of death, some more or less prevalent in different demographics and populations.
The US has a lot more deaths resulting from lifestyle choices, like car accidents and obesity. It's funny when you look at people who've already reached the age of 50, they have much better survival expectations than America, because by then, the lifestyle choices have had a chance to even things out. You're not comparing apples to apples.
Or maybe you're one of the 30 million Americans who don't have any health insurance coverage at all. You see, a big reason we pay so much for health insurance is the administrative costs involved in private, for-profit corporate insurance.
That makes no sense. The private market has an incentive to get administrative costs down.
Costs imposed by the regulatory burden placed on the industry by government.
My mother was the only daughter of a teenage single mother from a poor farming family who had her during the Depression. And yet, despite her meager income as a manicurist in a barbershop, she was able to pay for health insurance for both her and my mother. Why do you think health insurance was so cheap before your wonderful government started meddling?
About a third of what you pay goes to the people who oversee billing and collections.
Maybe because of the regulatory burden your holy government places on them?
And then, of course, there are the marketing and advertising expenses, and the profits that go to shareholders or private equity managers.
And profits are such a bad thing, right? If we actually had privatized healthcare, only those providers that provided the highest quality care at the lowest possible price would make any profits. How is this a bad thing?
Now, what happens if we have Medicare for all? Let's first consider a limited version that keeps private insurance as proposed by candidates including Joe Biden, Pete Buttigieg, and Kamala Harris. Now, the insurance costs remain the same because it's the same private insurers and the same co-payments and deductibles. The only difference is more of this would be paid through your taxes rather than by you directly, because the government would reimburse the insurance companies.
That's impossible! If it's paid for by taxes and not the consumer, then the health insurance companies have no incentive to compete based on price. Government regulations have already taken most of those incentives away, but this would get rid of the rest of them. So how would the costs not increase? You have to understand this as an economics professor, so I can only conclude that you're lying to push your agenda. I mean, really, it would be like an astrophysicist arguing for the flat Earth.
This could help bring down costs by giving the government more bargaining leverage to get better prices. But we don't know yet how much.
Yeah, and it also means more people going untreated while government bickers with providers, since government is by definition a third-party buyer. But let's let him finish what he has to say before I say more.
Now let's talk about a different version of Medicare for All that replaces private for-profit corporate health insurance, as proposed by Bernie Sanders and Elizabeth Warren. In this version, total costs, including a possible combination of premiums, co-payments, deductibles, or taxes, are even lower. So you'd come out ahead, and everyone would be covered.
So what? Everyone would be covered. Doesn't change the fact that there is a limited supply of doctors, medications, and other medical resources. Only difference is, now that healthcare is apparently free, demand for those resources is essentially infinite, which means it will be up to government bureaucrats to decide who gets what treatment and when. If you disagree, you need look no further than Britain's National Health Service.
Exactly! This doesn't do anything to increase the supply of healthcare. And as an economist, Rice should know that increasing supply is the only way to increase quantity and decrease price.
This option is far cheaper because it doesn't have all those administrative expenses or the marketing and advertising. It's public insurance that reimburses hospitals, doctors, and pharmaceutical companies directly and eliminates the bloat of private corporate insurance companies.
And even if it is cheaper, that doesn't mean jack if you're not actually getting the healthcare you need.
You'd keep your same doctor or other healthcare provider, and you could still buy private insurance to supplement Medicare for All, just like some people currently buy private insurance to supplement Medicare and Social Security. The only thing that's changed is you no longer pay the private, for-profit corporate insurers.
As Sweden learned when it implemented universal healthcare, this is a lie. As Swedish economist Klaus Bernpainter points out, universal healthcare was introduced in Sweden with the intention that it would only be for the poor. More well-off individuals could choose to purchase private insurance supplements if they wished. However, when Swedes saw apparently free healthcare, they ditched their private insurance in favor of what was seemingly free. This drove private health insurance costs through the roof, causing even more people to flee it in favor of the public system, and forcing doctors to either seek public employment or leave the profession. Suffice it to say, private supplemental insurance will all but disappear once Medicare for All is implemented.
Economists at the University of Massachusetts Amherst say Medicare for All that replaces private for-profit insurance would reduce costs by about 10%, mostly from lower administrative and drug costs. The Urban Institute estimates that households and businesses would save about $21.9 trillion over 10 years, and state and local governments would save $4.1 trillion.
And those projections are as doomed to failure as the initial projections I mentioned back when Medicare was first passed. The reason is simply that you don't have the same incentive to economize when you're spending someone else's money as you do when you're spending your own. That's not even getting into the political cronyism that always comes with this sort of thing. Hospitals, clinics, doctors' associations like the AMA, and politicians will all be making backroom deals to get more money for themselves, with consumers none the wiser since they don't ever see the bill. How do I know this will be the case with Medicare for All? Because it already is the case with existing Medicare. Not only that, but something else Reich knows perfectly well as an economist but chooses to ignore is that when people get something for a lower price or for free, demand increases drastically. You end up going to the doctor every time you get the sniffles, putting more of a strain on the already limited supply of healthcare resources, which again, Medicare for All does zip to alleviate.
Again, comparing private and public spending is radically disingenuous. But even if that's true, lower costs don't mean squat if people aren't actually getting the healthcare they need.
You know, if I didn't know better, I'd think the only thing Reich cares about is money.
Any Medicare for All is better than our present system. But the second version is far better because, like Medicare and Social Security, it is based on the simple and proven idea that we shouldn't be paying private for-profit corporate insurers boatloads of money to get the insurance we need. It's time for true Medicare for All.
And in a free market, we wouldn't, since only those providers that provided the highest quality care at the lowest possible price would survive. We shouldn't be paying government boatloads of our money just so that they can give most of it to talentless government bureaucrats and then use the rest to ration out crappy healthcare. Well, that pretty much wraps this one up. Thanks for being on, Lord Killian. And that's our 2 cents. So take it for what it's worth. Everyone, please take a moment to subscribe to my 2 cents on the BitTubers and BitChute platforms. YouTube has shown that it is no longer a viable platform for independent content creators, and we need to build a presence elsewhere before the inevitable censorship comes. The links to both profiles are available in the BitTubers tab on my website, my2centsvideos.com. Thanks everyone for watching. If you liked this video, be sure to like, share, and subscribe, as well as hit the bell to receive notifications so that you never miss an upload. And if you're a fan of my channel, please consider supporting me on Subscribestar, Bitbacker, or Patreon to receive special rewards. All links can be found in the About section of my website, my2centsvideos.com.